Hello, everybody across the country. As I said, we're down in windy, cold Victoria. Most of the rest of you probably haven't got as hectic weather as what we've got down here. But yeah, let's get into it. As Anna said, as financial advocates, we meet once a month and discuss some of the cases that are sort of more trending and becoming more trending as we go along. So I'm going to just share on one of probably the more common ones is means-tested care fees. I'm sure many advocates, not just financial advocates, have come across clients who have signed up with a provider, whether it's home care packages or residential aged care, and somewhere down the line they find out in a nasty way they've got an extra bill that they weren't expecting. And it's usually because the provider hasn't explained it properly at the beginning, hasn't got them to fill in an income and assets assessment with Centrelink, and suddenly they're slammed with this bill. And it can be quite expensive depending on what income and assets the client or the resident has. I'll just go through a little bit of the terminology. So as with all of our work, there's a billion and one acronyms for everything. So residential aged care home, some will know it as residential aged care facility, Services Australia, EPOA, enduring power of attorney, or just simply power of attorney, my aged care, and means-tested care fee. Probably another one that I should have popped in there is income and assets assessment, or INA. Is another common term for that. So with today's case study, I've changed the names. Not that anybody here would probably recognise it, but client Tony lives in an RACH after having been hastily admitted to permanent care due to alleged deterioration of his mental health diagnoses, resulting in him no longer being able to live safely at home with his wife. Client's daughter Maria has contacted ERA to discuss the fees that she's suddenly now getting a bill for from the home and wanting to know what this is all about. Maria states that she has tried to negotiate with the home, but that the home is insisting that what is owed is correct, and it's determined by Services Australia, so therefore the home hands are tied, essentially. Maria stated that as her father has multiple diagnoses, including dementia, and he has been assessed as having no capacity, so she's the EPOA and she'll engage with advocacy on his behalf. Maria states that the income and assets assessment has been completed at Services Australia on behalf of her father, and she doesn't understand why the assessment is saying her father is liable to pay so much as he has no assets. So the next steps that I asked her for, and I mean, you guys will all be familiar with the steps, so I don't really need to explain it, but you just ask for the relevant documents that apply to the situation. As many of us would probably be aware, clients don't always tell you everything that you need to know, so it's good to have the documents in sight so that you can see what Services Australia has actually said, what the home is actually saying. Just having everything in hard fact is always a good practice to just ask for those documents, and she consented to send those things through. So I got the fee statements from the home, the letters from Services Australia saying what was owing, and the contract from the home to just see if there was any wobbly bits in there, which we often see as well, things that are pre-ticked or not ticked or totally overlooked in the process of an admission to permanent care. So I reviewed the documents in relation to the legislation that we all use and in relation to what MAC says and Services Australia says. And then, we provide feedback to the client regarding those findings. So what I found is that the home was actually sold a few years ago. Tony's home was sold and it was transferred. Sorry, it was actually transferred into Maria's name and then sold 3 years ago. And according to the gifting rules, which obviously Maria was not aware of when she phoned us, the proceeds of the home were still acknowledged by Services Australia as being in Tony's name. And I've just popped the link in there if you want to have a look at how the gifting rules all work. I'm sure you're all aware if something happens in the previous 5 years, it will still count towards the client's or the resident's income and assets assessment. And so the assessed care fee amount that is determined by the income and assets assessment outcome is higher. It was higher for Tony since the value of the second home, not his home that he was living in with his wife, was still counted as part of his asset. And so, yeah, as the POA, Maria was up for it. She wasn't up for it, but she was up for it. She was on the hook for it. And yeah, it wasn't the greatest news for her, but she was very appreciative for advocacy having explained how this all works, because the home hadn't gone to that extent. I'm sure many of you've had the experience where, although there are some finance people in homes that are very good at explaining things, many of them are bean counters. They're not so good with people. And so when it comes to explaining the ins and outs and taking time to ensure that clients understand things according to their understanding and not to the facility's convenience, it's a really tricky, and they're often missing each other completely. So yeah, just the outcome really was that she wasn't happy with the outcome. She wasn't happy that she was liable to pay these fees on her father's behalf as his POA, but she was very grateful for advocacy taking the time to sort of walk her through the steps of, listen, you didn't quite fill in the income and asset assessment correctly. She had left the second house off the income and assets assessment because in her mind it was in her name, so therefore her father didn't have to put it on his income and assets assessment, and unfortunately it didn't quite work that way. But yeah, she was at least happy to have an explanation of what it was all about and how to proceed with the payment of those fees, which was a lot.
If you need help understanding your rights, call Elder Rights Advocacy on 1800 700 600. We're here to help.